Welcome to This Explainer. Today we're going to take a really fascinating dive into the human mind to unpack a topic that honestly touches pretty much everyone at some point: anxiety. But we're going to skip the generic advice today. Instead, we're looking at this through a structured, strictly medical lens, breaking down the actual science, the symptoms, and the proven solutions. So let's get right into it.
To start us off, ask yourself this: when does everyday worry actually cross the line into a medical disorder? Because look, we all get nervous, right? Maybe your heart starts hammering before a big job interview, or you get those notoriously sweaty palms before a major test. That is an entirely normal, deeply human response. Actually, a little bit of anxiety is pretty beneficial. It keeps us on our toes in dangerous situations and sharpens our focus so we stay safe. But where's that invisible boundary where this helpful, built-in alarm system turns into a debilitating medical condition?
Okay, let's dive into this. Medical professionals actually draw a very distinct line between the two. On one side, you have normal anxiety, which, as we just said, is highly beneficial. It keeps us safe, and it makes total sense given the context of whatever stressful event you're facing. But in anxiety disorder, that represents something fundamentally different. It crosses the medical line when the anxiety starts actively interfering with your daily ability to function. Your reactions become completely out of proportion to the actual situation at hand. Essentially, it's an uncontrollable overreaction. You can't just flip a switch and turn the response off, no matter how hard you try. Now, before we look at the general population, it's definitely worth noting the demographic differences here. Statistically speaking, women are about 2 times as likely as men to develop an anxiety disorder. It's a really significant statistical difference, and it changes how we view population health, highlighting how these conditions can manifest differently across various groups. What's really striking about this data, though, is just how incredibly common these conditions actually are. Seriously, if you've been battling uncontrollable worry, the numbers confirm you are far from alone. Specific phobias, which are those intense, overwhelming fears of very specific things or situations, they affect up to 12% of the US population. Social anxiety disorder comes in at about 7%, and generalized anxiety disorder, which is that constant, unrealistic worry about everyday stuff, impacts about 3%. We are talking about millions upon millions of people navigating exactly what we're discussing today. And this brilliantly illustrates one of the most misunderstood aspects of anxiety. It is absolutely not just in your head. While the psychological symptoms like panic, dread, obsessive thoughts, and poor concentration are profound, the physical toll is equally severe. We're talking real heart palpitations, shortness of breath, nausea, dry mouth, and severe insomnia. People with anxiety disorders often experience very real and sometimes totally terrifying physical changes in their bodies. Honestly, just validating that physical reality is a huge step in understanding the true weight of this condition.
So, if the symptoms are both deeply mental and intensely physical, well, it begs the next logical question: what actually causes an anxiety disorder? We know for a fact it's not a character flaw, and it's certainly not a weakness. So what is happening biologically and environmentally to trigger the whole shebang? Let's deconstruct the root causes.
The first primary driver brings us right down to the chemistry of the brain. Neurotransmitters are chemical messengers that basically help your brain communicate. The main players here are serotonin, dopamine, norepinephrine, and gamma-aminobutyric acid, which is commonly known as GABA. These chemicals regulate your mood, your fear responses, and your stress levels. When there is a chemical imbalance in these specific neurotransmitters, it's essentially like your brain's communication lines are sending the wrong texts, and that directly contributes to an anxiety disorder.
Beyond just the chemistry, there's the actual anatomy. Enter the amygdala. It's this tiny, almond-shaped part of your brain that acts as your central command center for fear and anxiety. Studies have shown that in people with anxiety disorders, this area actually shows increased activity in response to anxiety cues. It is physically overprocessing these signals. Think of it like a smoke detector that's way too sensitive. It's ringing the alarm bell much louder and for much longer than it actually needs to.
We also have to look at genetics. It turns out, if you have a first-degree relative, like a biological parent or a sibling, who has an anxiety disorder, you are at an increased risk of developing one yourself. This strongly suggests that a clear genetic link is passed down, meaning some of us are just hardwired to be slightly more susceptible to these conditions right from the day we're born.
But hey, it's not entirely up to genetics. Our environment plays a massive role in this puzzle. Experiencing severe, long-lasting stress or traumatic events doesn't just make you feel bad in the moment. Over a long period, chronic stress can literally alter the balance of those exact neurotransmitters we talked about earlier.
Outside forces and major life events can physically reshape the chemical landscape of your brain, which can ultimately trigger the disorder.
With all these complex causes, how do doctors actually go about diagnosing it? Because, there's no simple blood test or X-ray for anxiety. Instead, doctors use a highly structured two-step approach. Step 1 is a physical exam. This is crucial to rule out underlying physical conditions that might just be mimicking anxiety. For example, an overactive thyroid or hyperthyroidism can cause a rapid heart rate and jitteriness. Once those physical causes are officially ruled out, Step 2 is a comprehensive mental health interview. This is often done by a psychologist or psychiatrist who uses specific criteria outlined in the DSM-5 manual to evaluate the intensity and the duration of your symptoms.
Getting that formal diagnosis is absolutely crucial because left untreated, anxiety disorders can lead to some incredibly severe medical and emotional complications. We aren't just talking about daily discomfort here. We're looking at a deeply decreased quality of life, a high risk of substance use disorders like alcohol abuse, as people desperately try to self-medicate, the onset of major depressive disorder, and even an increased risk for serious cardiac events like a heart attack, simply due to the constant physical strain on the body. And in severe cases, it can tragically lead to suicide. Make no mistake, this is serious medical terrain.
So the crucial point is this: anxiety is a legitimate medical condition that requires treatment, period. It is not a character flaw, it is not a lack of self-discipline, and you absolutely cannot just will it away. Realizing this is often the single most liberating step for someone struggling with anxiety. It allows you to finally stop blaming yourself and start treating the actual medical reality of the condition.
And understanding that medical reality is what paves the way for healing. This brings us to the primary paths for treatment, which usually relies on a powerful dual-pillar approach: medication and psychotherapy. On the medication side, doctors might prescribe antidepressants like SSRIs to help address brain chemicals over time, benzodiazepines for short-term panic management, or beta blockers to literally stop the physical symptoms like a racing heart. But medication is always best paired with psychotherapy, specifically cognitive behavioral therapy or CBT, which teaches you to identify and rewrite unhealthy thought patterns. There's also exposure therapy, where you safely and gradually confront your fears to build tolerance. Together, these two tools treat both the physical and the psychological root causes.
Now, in addition to professional medical treatment, there are some incredibly powerful, actionable self-care strategies that you can start using today to make your treatment even more effective. Stress management techniques like meditation and targeted breathing exercises are fantastic for calming the nervous system down. Joining a support group can give you a much-needed sense of community and shared coping strategies. Educating yourself, just like you're doing right now with this explainer, is vital. And here's a very practical tip: limit or avoid caffeine. Caffeine can directly exacerbate the physical symptoms of anxiety, like those heart palpitations and jitters we mentioned earlier. So cutting back can actually offer some immediate physiological relief. All right, we've covered the science, the symptoms, the brain chemistry, and the proven treatments. You now have a solid, structured understanding of what anxiety actually is, not as a personal failing, but as a completely manageable medical reality. So I'll leave you with this final thought and question. Now that you know the science, what step will you take today to reclaim your peace of mind? Whether it's calling a doctor, trying out a breathing exercise, or just deciding to be a little bit kinder to yourself today, the power to begin healing is right there in your hands. Thank you so much for joining me for this explainer, and I can't wait to explore our next topic with you soon.